Hello, good evening to all of you. We'll be beginning soon in 1 or 2 minutes. Till then, I can expect you all to go through whatever is being done in the past 3 lectures, right? Can we just go through it? There are people on YouTube as well who are waiting. So, NIPER forms are out. I hope you all are aware of that, right? And we would have started filling the form as well. Hoping. So, बहुत कम time है between GPAT and NIPER, like hardly few days. So you can start preparing for your NIPER from now itself. Extra things what you need, all bioinformatics tool, right? So like Blast, Clast, TopCat, AdMat, these are all bioinformatics tool that may appear in your exam. Besides this, certain new Hatch-Waxman Act, Orange Book, go through it once, right? And certain name reactions like Merrifield, Robinson, Gap-Year synthesis, you can have a look at those as well. And specifically, a tip for y'all, go through NRF2 and NF kappa beta agents, right? Resveratrol, that is one of the agent that you should look upon. So I think so we can begin, right, Siddhesh sir? Ajit sir, anybody? Shall we begin with the session?
Ajit sir.
Hello,
We'll wait
sure
for
we
one
can
moment.
do now. Yes.
Okay, cool. Cool. So today we will be discussing about the NBEMS. So we all are aware that a new board is going to take up GPAT now, right? This board has its expertise in few areas, right? So today I went through the website and I found few of them. Can we mute everybody?
Payam, just 2 minutes. I
Sure.
think you guys should mute yourself. Jyoti, Anju, Chintu, Gayatri, and all people. Samriddhi, are you there?
ఎందుకు మరి చిల్లర చిల్లర చేస్తున్నారు?
Haripriya, you can mute yourself once.
Can we please mute?
Samriddhi, are you there? Samriddhi?
Yeah.
Yes, so I think we can proceed now. So last warning to all, Samiksha, Ankit, Anju, Niluri, please mute yourself.
Yeah.
And then
So
we can go with the class. Yes,
yeah,
Payam, over to you.
sure. So today I was just going through the website of NBMS and I saw few of the previous year's papers, right? So they conduct exams for NEET PG for anesthesia, urology, hematology, cardiology, etc. So what all questions they can relate in pharmacy with that, right? सबसे पहले we have anesthesia. So anesthesia में we have two types, local anesthetic and general anesthetic. So you should know the basic mechanism, like if they are sodium channel blockers, right? So there are two categories from medicinal chemistry point of view. One is ester containing, one is amide containing. Like procaine is an ester containing local anesthetic, lidocaine is an amide containing local anesthetics. Moving on, general anesthesia. Can somebody tell me in the chat box quickly what are the 4 stages of anesthesia? What are the 4 stages of anesthesia? What quickly? Can we please quickly type, and on YouTube as well? I'm seeing your reply as well. You all can also type simultaneously. Analgesia, right? इतने slow क्यों है reply? Excellent, Manisha. Delirium. I hope we are not tired, है ना? Then we have surgical anesthesia where we actually perform the desired surgery. And in the final stage, we have medullary and cardiac paralysis. So this stage is undesirable because once this stage comes, that means a person may suffer from respiratory depression and eventually die. Okay. So these are the 4 stages of general anesthesia, and they can ask upon these stages, or they can ask upon the different categories of drugs. Like you have inhalational and you have parenterals, right? Parenterals may you have the most famous drug. Can somebody tell me which is an anesthetic known as dissociative anesthetic? Can somebody tell me an example of a dissociative anesthetic? Dissociative. A hint for all: after giving that anesthetic, eyes remain open, and it is used in brain surgery. Very good. Ketamine, excellent. Ketamine is a. Then we have a very painful parenteral, which is propofol. So it is a painful injection because any injection which has an emulsion, it will pain, and any injection which is a solution will not pain, right? So emulsion की बात निकली है. So Aman sir would have taught you all about emulsion maybe, or he'll be teaching. Can somebody tell emulsion is a what kind of dosage form? Monophasic or triphasic, or it can be biphasic. Okay, biphasic. Biphasic में two. What are the two? Very good, Tejaswini. What are the two liquids? Very good, very good. So yeah, you can relate Sutix as well. I always tell that whenever you're studying, एक subject मत पढ़ो. You always link one subject with other subjects because that is your basic fundamentals, right? So in inhalational we have anybody volatile liquids and gases. Again, two categories. एक है that is volatile liquids and gases. So we have halothane, all the fluorines, enfluorine, desflurane, sevoflurane, isoflurane, methoxyflurane, saviflurane, fluorine, right? Gases में we have nitrous oxide. Nitrous oxide का दूसरा नाम क्या है? I had taught you all in the first lecture. What is another name for nitrous oxide? What is a synonym from inorganic chemistry? Very good, laughing gas. Very good, Chintu, laughing gas, right? So all these things can come from hematology. So hematology is basically blood related. So we can get questions on coagulants like vitamin K and rutin. Rutin को कौन सा विटामिन बोलते हैं? Rutin is known as which vitamin? Again, पहले पढ़ाया है. So I hope that you all can relate. Rutin is which vitamin? Vitamin. Nobody knows. भूल गए. Vitamin H. No. Vitamin H is biotin. Rutin is vitamin P. Why P? P for permeability. P for permeability. Permeability of the blood vessels. Okay. Next we have hyperlipidemia. So hyperlipidemia we have majorly two categories of drugs. One is statins. One is fibrates. Right? Can somebody tell me the mechanism of action of statins? Can somebody tell me the mechanism of action of statins? भूल गए. Very good. Very good. HMG CoA reductase inhibitor. So it is a rate limiting step, right? अच्छा, rate limiting steps से याद आया. Let me see how strong is your chemistry. Can you tell me in SN1 reaction what is a rate limiting step? In SN1 reaction, what is your rate limiting step? Which is your rate limiting step in SN1 reaction? Quickly. Sirisha, can we please mute? Very good. Formation of carbocation is a rate limiting step. RL, rate determining step, right? RDS. Fibrates may we have clofibrate, phenofibrate. And here GPAT 2023, the one that I gave, this was a question. Which group is present in? They had asked about a moiety, IUPAC name, right? Butyric acid. So you should know the medicinal chemistry point of view as well, like which ring is present or which functional group is present. Okay. And finally, we also have bile acid sequestrants. So bile acid sequestrants are also very not frequently used, but there are cationic exchange, right? So bile acid sequestrants like cholesterol, cholestyramine are being used. Okay. Next up, we have fibrinolytics. So can somebody tell me? I'll be telling you a name of a drug. Can you tell me the category of that drug? Streptokinase. Streptokinase, and from where it is obtained, the source of streptokinase. The source of streptokinase. Nobody knows. Nobody knows. That's sad. Very good. It is a fibrinolytic agent. Very good. Okay, I think I should take the names of the participants. तब जाके वो जगेंगे, otherwise they are sleeping. Akita, Akshata, Ankit, Apurva, Bhargav, Chintu, Diksha, Deepika, Gargi, Gayatri, Gaurav, Haripriya, Jyoti, Manisha, Mahima, Fatima, Mohammed, Neena, Monica, Prachi, Prerna, Raghavan, Rudra, Sakshi, Saloni, Satvika. I hope you are awake. Sheetal, Sneha, Sushmita, Tina, Varsha, Vinay, Vivek, Yashwan. I cannot take all names, but I hope that you all are awake. Group C, beta hemolytic streptococcus. So streptokinase is obtained from, and this is a question of Manipal 2023, है ना? The one that just like happened 1 year back. Group C, beta hemolytic streptococcus. You have to remember the entire source for streptokinase, है ना? It is a clot breaking enzyme, है ना? Next, can you tell me epsilon amino caproic acid, ICA? ICA is belonging to which category? And tranexamic acid. Can you tell me the category of tranexamic acid and epsilon amino caproic acid? Quickly. Yeah, it is a biotechnological product. Very good. Yes, they belong to the antifibrinolytic. So fibrinolytic का काम क्या है? To break the fibrin. Antifibrinolytic का काम क्या है? To let the fibrin remain, persist. ठीक है? So fibrin is an insoluble material that is involved in your clotting cycle, right? You would have heard about clotting factors. Okay. Clotting factors की बात निकली ही है. So can somebody tell me clotting factor कितने होते हैं? And which clotting factor is omitted? Which clotting factor is omitted? 13 are there? Very good. And that sixth one. And which one is omitted? Sixth one. Excellent. So first factor is fibrinogen. Second is prothrombin. Third is thromboplastin. Fourth is calcium. That is why we tell that calcium is very important. Calcium is required for your heart health, calcium homeostasis, right? We have verapamil, diltiazem, calcium channel blockers. Then we have sinacylate, which is a calcium sensitizing receptor drug. Calcium is required for bone health, especially in postmenopausal female, because after menopause, estrogen levels are altered. So calcium is reduced, bone resorption capacity, bone mineral density is altered. So calcium supplements are given, right? Even for pregnant women, lactating women, calcium and folic acid tablets are prescribed, calcitriol. And you would have seen those sachets, 60,000 international units. Factor number 5, we have labile. 7 is stable. Labile is also called as pro-axillary. Stable is also called as pro-convertive. Now, 8, can somebody tell me what is factor 8? Clotting factor 8 को क्या बोलते हैं? What is clotting factor 8? Is it anti-AHE, anti-hemophilic factor, anti-hemophilic factor A, and anti-hemophilic factor B? So your ninth clotting factor is called anti-hemophilic factor B. और दिसंबर में कौन सा फेस्टिवल आता है? दिसंबर में कौन सा फेस्टिवल आता है? 25 दिसंबर. वेरी गुड. क्रिसमस पावर, क्रिसमस फैक्टर, क्रिसमस फैक्टर. फैक्टर 10 इज स्टुअर्ट पावर फैक्टर. फैक्टर 10 इज स्टुअर्ट पावर फैक्टर, राइट? 11 कौन सा है? व्हाट इज 11? प्लाज्मा थ्रोम्बोप्लास्टिन. प्लाज्मा थ्रोम्बोप्लास्टिन. इज इट प्लाज्मा थ्रोम्बोप्लास्टिन? फाइब्रिन स्टेबलाइजिंग फैक्टर कौन सा है? विच इज अ फाइब्रिन स्टेबलाइजिंग फैक्टर? इज इट फैक्टर 13? Is factor 13 fibrin stabilizing factor? Okay, why are your replies coming so slow today? थक गए हो क्या? इतनी slow? YouTube पे lag है 5 seconds का, फिर भी वहां पे जल्दी reply आ रहा है. I hope we are fresh, right? So all this can appear into your exams, right? Moving ahead, cardiology. So in cardiology, we have arrhythmia, angina, and hypertension. है ना? Hypertension में all categories of drug you should know, right from captopril to losartan to reserpine. Reserpine was previously used, now it is not used because it has a suicidal tendency. Reserpine खाने के बाद suicide करने का मन करता है ना? So ACE inhibitors, angiotensin receptor blockers. What is the most prominent side effect of ACE inhibitors? ACE inhibitors ka, which is the most prominent side effects? Everybody? Tejaswini Gargi. Anybody who can tell me? Chintu, Haripriya, Manisha, Fatima, Vinay, Vivek. Very good. Dry cough. Dry cough क्यों होता है? What is the reason? वो तो हार्ट पे है ना. ACE inhibitors तो हार्ट पे है. कॉफ सेंटर्स तो ब्रेन में है. ऐसी क्या चीज है जो उसे ड्राई कॉफ कराए? There is one inflammatory mediator starting from B, which is that very good bradykinin. Bradykinin, it is a nonapeptide. So bradykinin के levels की वजह से ही dry cough होता है. Okay. So yeah, this is very important. Then we have clonidine, alpha 2 agonist, है ना? Then we have beta blockers, propranolol, metoprolol, esmolol, sotalol. Then we have alpha plus beta blockers, carvedilol, labetalol. Okay. Arrhythmia. Can you all tell me the Vaughan-Williams classification for arrhythmia? Can somebody tell me Vaughan-Williams classification for arrhythmia? Vaughan-Williams classification for arrhythmia. Vaughan-Williams. नहीं पता. I'll write it on the board and then you can remember. 1, 2, 3, 4. 1A, B, C. So 1A is intermediate sodium channel blockers. 1B is weak sodium channel blockers. 1C is strong sodium channel blockers. Right? 1C is strong sodium channel blockers. Second, we have beta blockers. Right? Third category, we have potassium channel blockers. Very good. And fourth category we have is calcium channel blockers. Verapamil, diltiazem, nifedipine, nimodipine. Potassium में we have dronadenone, amiodarone. Beta में we have sotalol. अच्छा, sotalol is the only drug that can act as class 2 as well as class 3. Okay, sotalol can be a beta blocker as well as a potassium channel blocker. Excellent. Good speed. Please do not forget this. Sotalol is a dual blocker. Okay, don't forget this. Next up, we moving on to hypertension, arrhythmia, and angina. Angina may there is one extra drug that you should know, which is a Rho kinase inhibitor. Rho kinase inhibitor, and the drug name is Fasudil. You need to remember the name of this drug, Fasudil. Please write it. And one, you should know all these, that we all know that classification, but we don't know the person who gave this classification. So sometimes they might ask you that according to Vaughan-Williams classification, what is a category of arrhythmic drug? So you all would be thinking, ये तो क्या है पढ़ाई? No, it is the same classification that we studied. Okay. Now moving ahead, we have nephrology drugs. So in this we have diuretics. So we have 5 kind of diuretics: loop, osmotic, thiazide, potassium sparing, and which is the fifth category? Which is the fifth category? Carbonic anhydrase inhibitor. Carbonic anhydrase inhibitors, right? Is it? Loop diuretics. Have we heard about furosemide? Have we heard about bumetanide? Have we heard about ethacranic acid? Ethacranic acid. Phenoxyacetic acid group is present in which ring? Phenoxyacetic acid group is present in which drug? Let me see how many people have studied Rangandial and tolbutamide. No, 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 no. Tolbutamide belongs to the category of anti-diabetic. Chlorpropamide, tolbutamide, and they are all diuretics. Sulfonylureas. Very good. Ethacranic acid has phenoxyacetic acid, PAA. Furosemide has 5-sulfamyl group, 5-sulfamyl. Sulfamoyl group, 5-sulfamoyl group. Right? Osmotic में we have mannitol, isosorbide. अच्छा, isosorbide is drug for which other category? Isosorbide dinitride, isosorbide mononitride, pentaerythritol tetranitride. These are all drugs of which category? Very good. Angina, angina. Shabash, good going. Right? So that is for diuretics. Carbonic anhydrous में we have acetazolamide, methazolamide, brinzolamide, है ना? Thiazide, which is a high efficacy. Loop is a high efficacy. Thiazide is a moderate efficacy. Rest all are low efficacy. Loop acts on sodium potassium 2 chlorine cotransporter, right? Carbonic anhydrous acts on carbonic anhydrous enzyme. Thiazide and other drugs can add on sodium chlorine importer. Which site do they act on? Do we know site 1, 2, 3, 4? PCT, DCT, Henle's loop, ascending limb, descending limb. Do we know the site at which they act? Uspe bhi there are a lot of questions. Okay, all the participants watching this and who are going to watch this video, please note the site of action of diuretics in the urinary tract. Right, so it can either act on site 1, site PCT, DCT, Henle's loop, collecting tubule. We will be studying that. Okay, loop diuretics act on the, where do loop diuretics act? Do they act on PCT? Do they act on PCT? Okay. Thiazide, do they act on DCT? Carbonic anhydrous कहाँ act करते? Potassium sparing act near the collecting duct. Potassium sparing act near the collecting duct. Okay. Why is everybody blank? Have we not studied about this? If you have not studied, then please study, and we will also study in the further lectures where I'll be teaching you diuretics. Okay. So just make a note of that. It's very important. Next up, we have moving on. We have, wait, something happened on my screen. Yeah. We have urinary antiseptics. So have we heard about hexamine, hexamethylene tetramine, or urotropin? Have we heard about fluoroquinolones? क्या हमने सुना है about nitrofurantoin? Have we heard about furazolidinone? They are all urinary antiseptics. Okay. Moving on, we have pulmonary drugs. So they have asked question in pulmonary drugs on asthma a lot, right? Right from leukotriene antagonists to 5-LOX inhibitors to your bronchodilators like phosphodiesterase inhibitor like theophylline to beta agonist, beta 2 agonist like salbutamol, albuterol, bitalterol, है ना? Those all things. Then we have a mast cell stabilizer, corticosteroids, very good, betamethasone, dexamethasone. DMDM, betamethasone, dexamethasone. अच्छा, dexamethasone is a dextroisomer or a levoisomer of betamethasone? Medicinal chemistry. Dexamethasone is a levoisomer or a dextroisomer of betamethasone? नाम में ही है D. Very good, dextroisomer. Right. So this is important. Mast cell stabilizer में sodium chromoglycate, ketotifen. Have you heard about this drug? Sodium chromoglycate, ketotifen. 5-LOX में ziluton. ल्यूकोट्राइन में मॉन्टेल्यूकास, जफीरल्यूकास्ट. एंटी आईजी एंटीबॉडी में ओमैलिजुमैब. हैव यू हर्ड अबाउट ओमैलिजुमैब? monoclonal antibody, right? So I hope we are able to remember this. This all questions may have been asked some or the other, है ना? Next, immunosuppressants. Immunostimulants पे they haven't focused much, so you, but just remember immunostimulants GM, CSF and GCSF. Granulocyte macrophages colony stimulating factor and granulocyte colony stimulating factor. So we have two drugs, filgrastim and selgastrim. Filgrastim and selgastrim. Does somebody know that which is filgrastim and which is selgastrim? मैं तो कुछ भी कहीं भी लिख सकता हूँ. Do you all know which drug belongs to which category? Which is GM-CSF and which is CSF? We don't know. Have we not studied about KD Tripathi में immunology का chapter? We haven't studied selgastrim के बारे में. Oh, wait. Have we not studied about that? Have we not studied about that? Okay, homework for all. A hint, what I have written could be right. Okay. Immunosuppressants में we have one very famous drug, mycophenolate mofetil. Mycophenolate mofetil. Right, on YouTube somebody has replied, I think so. Yes. Mycophenolate mofetil. Okay, जुड़े रहिएगा मेरे साथ. Do not leave. This 1.5 hours is going to be very special for you, trust me. Don't leave. Even if you're tired, you don't feel like writing, sit down and listen to the lecture. Always whenever you're tired and you don't feel like studying, sit back and listen. Sometimes whatever you listen is being stored. You have a lot of memories in our body. We have muscle memory. So that is why they say na ke likh ke padho, write as much as you can. There is a visual memory. Sometimes whatever you see, so if you see some colorful text, some colorful table, you remember. Audio memory, acoustic memory, right? Acoustic audio memories when you listen to something. So all these memories are going to help you in exam. So a smart student will always utilize all of these three combination, right? Endocrinology may we have diabetic drugs. So we have right from oral hypoglycemic SGLT inhibitors, dapagliflozin. What is dapagliflozin, canagliflozin, empagliflozin? Glut, GLP agonist, DPP4 inhibitors, thiazolidine diones, bigonides, chlor, sulfonylureas. Have we heard about this drug? Have we heard about this drug? I hope yes. Have you heard about chlorpropamide, tolbutamide, glimepiride, glipizide, glyburide, metformin, fenformin, rosiglitazone, pioglitazone, sitagliptin, vildagliptin, saxagliptin, tenagliptin? So these, acha, diabetes is very, 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 very important. 115% diabetes पे question आ सकता है GPAT में, because there are a lot of new discoveries, lot of companies like Biocan, biopharmaceuticals and all that are working upon recombinant products, insulin and all, right? So insulin के analogs, lente insulin, lispro, glargine, glulicine, aspartate, lentelis, glargine, glulicine, aspartate, all of these you should know the drugs of diabetes. I will tell you, do not even dare to leave diabetes. Study it completely, right from MOA to its side effects, because lot of side effects like hypoglycemic shock, weight gain. Some of them have weight, right? So fenformin ka lactic acidosis, there's a major side effect. So these are being asked, है ना? So don't leave that part. It is very important. Moving on, cancer, something that you cannot leave again. Right from your topoisomerase 2 inhibitor to topoisomerase 1 inhibitor to your anti-metabolites to your alkylating agents to your platinum compounds to your HER inhibitors to your SERM selective estrogen receptor modulators like tamoxifen, riloxafen. HER2 may we have trastuzumab, platinum may we have cisplatin, carboplatin, oxyplatin, alkylating may we have chlorambucil. Chlorambucil is a very common drug, cyclophosphamide. Anti-metabolites may we have methotrexate, 6-mercaptopurine, 6-thioguanine, 5-fluorouracil. Topoisomerase 2 may we have etoposide, tenaposide. Topoisomerase 1 may we have topotecan, irinotecan. You know, these all drugs are important for your exams. You should know all the categories of drugs. You know, they are very important. Vinca may we have vincristine, vinblastine. Taxane may we have paclitaxel, docetaxel. Nitrosoureas, right? So all these drugs you should know, right? Moving on, gynecology. So from gynecology, they ask mostly on contraceptives. So you should know about the contracepting like the mini pill. So mini pill is also called as progestin only pill. And every particular pill has two components. One is progesterone component and the other is estrogen component. So can somebody tell me ethinyl estradiol कौन सा component है and norgesterol कौन सा component? Which component is an estrogen component and which component is a progesterone component? Norethindrone, norgesterol. Let me know how many people have studied. Good. I'm happy that nobody is leaving the meeting. We have 40 participants and all of you all have joined. Good. On YouTube also. Good, good, good. I hope we are there on YouTube. We don't leave in between. Right? Norgesterol, can nobody knows? Nobody knows. Is everybody sleeping? Acha, estrogen. Very good, Gayatri. Very good, Haripriya. Ethinyl estradiol is a estrogen content. Sorry, estrogen analog, and norgesterol is a progesterone. Right? So this is all that they ask from gynecology point of view. Now, gastroenterology. डू नॉट लीव, थोड़े ही टाइम में हम कौन बनेगा करोड़पति भी खेलेंगे. ओके, वी आर गोइंग टू प्ले कौन बनेगा करोड़पति एज वेल इन सम टाइम. So stay tuned in the lecture. And my every new lecture will bring a new surprise for you. So I will try to incorporate something unique in my lecture. Okay, so today we have कौन बनेगा करोड़पति in our lecture. So ulcer में we have category. चलो जल्दी से बताओ, drugs बताओ. Anti-H pylori, amoxicillin, metronidazole, amoxicillin, metronidazole. Then we have ulcer protective, ulcer healing, carbinoxolone, colloidal bismuth substrate, sucralfate. सुना है ये सब ड्रग के बारे में? Are anticholinergics also used? Which anticholinergic is used as an anti-ulcer? What is GPPI? What is GPPI? PPI, I think so. You're writing PPI, right? Proton pump inhibitors. I was supposed to write that. Okay, proton pump inhibitors, omeprazole, pantoprazole, hydrogen potassium ATPase pump inhibitors, right? Or then other H2 antagonist, cimetidine, famotidine, ranitidine, H2 antagonist, right? 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 Done. So all these questions are being asked frequently in the examination. So you should be well versed with all of them, right? So we will play Kaun Banega Karodpati soon, not now. It's not a right time. So yeah, this pura ekdam setup I have made for you. But first, let's study something else as well before we go. So let's move on to some cognosy, because cognosy is very essential, and there are 10 questions from cognosy, and those 40 marks are direct. They cannot ask application based question in cognosy. They cannot ask. So application based question can be in ecology or medicinal chemistry or organic chemistry or sutics. But cognosy is a subject where they will ask direct questions, right? So one of this is a table. This table is very well designed. So please note sapwood and heartwood. There are two types of wood. So you would have heard about sandalwood and cassia. Sandalwood and cassia. So they both are woods only. They are obtained from woods. Chandan, right? We've all used chandan wala soap, sandalwood soap. So sandalwood and black katechu is a hardwood, while quassia is your softwood. While since there is a question of black katechu, all the smart public present in this lecture, can somebody tell me the difference between the black katechu and the pale katechu? Which katechu belongs first? Tell me. I will tell you all a family. You have to tell me कौन सी family में which comes, okay? So Leguminosae family में which katechu comes? Leguminosae family में which katechu comes? Katechu comes. YouTube, I'm seeing you all as well, okay? Don't worry. Very good. Leguminosae family में black katechu comes. Rubiaceae family में pale katechu comes. Rubiaceae. Pale katechu is also called as Uncaria gambier, or black katechu is also called as Uncaria gambier. Which katechu is called what? Is pale katechu also called as Uncaria gambier? I mean, the source is Uncaria gambier, and here it is Acacia katechu. Which katechu is called Katha? Katha, that we apply in pan. Katha, which is called as Katha. Very good, excellent. Black katechu. It is also called as Katha. And there was one more point. Gambier fluorescein test. Which of the katechu shows positive Gambier fluorescein test? Very good. Oh, no, it is not black katechu. Yes, very good. It is a pale katechu. Pale katechu shows a positive Gambier, na? Gambier is spelling me Gambier as from the source. So Gambier fluorescein test is positive in pale katechu, while it is negative in black katechu. है ना? So these kind of questions they ask. है ना? What was it? Any application? No, just understanding. So this is why I used to personally get scared. I was sure that my 100% marks are going to go in cognosy, because I used to get confused between synonym, biological source. But trust me, out of 11 cognosy questions, 10 of my questions were right in GPAT 2024. So you can imagine the amount of fear that you have and the amount of studies that can overcome that fear, right? So trust me, it is very easy. Next up, we have hormones. Since it's a new, there were no questions on hormones in the last 6 years. But before that, there were questions on hormones. So once just study about these 5 hormones. There are other hormones as like florigen, jasmonic acid, but it is not required at this level. Oxane is indole 3-acetic acid, and it is responsible for root initiation. सबसे ज़्यादा confusion is here only. Cytokinins, gibberellins, and shoot. Cytokinin is for shoot. Auxin is for root. Rara. Are. You know, there are so many people from South. You would have heard about that song, Rara Sinnato. Rara Sinnato song, right? And A.R. Rahman also you can remember Auxin ka A and R for root. But I hope you can remember this Ra. Auxin for root and shoot ka CS. Cytokinins ka shoot. How many people know about this song? How many people know about this song? I guess there are a few South Indians also in today's lecture. They would have heard about this song. है ना? So relate, always relate your studies. है ना? Chalo, chalo. Good, good, good. So gibberellins may we have gibberellic acid. So gibberellic acid is again very widely and commonly used agent. Okay. Gibberella fugicora, and the disease is caused. This has been a GATE 2024 question. It causes Becanase disease or a foolish seedling disease. Foolish seedling disease or a Becanase disease. Please write this. Please write this. It's very, very important. Done? Done? Are we done? Okay. Done? Chalo. Chalo. Moving ahead, moving ahead. We have abscisic acid, which is a stress hormone. We have abscisic acid, which is a stress hormone, right? So it is inducing stress and it accelerates the stress substances. And ethylene, it is the only gaseous hormone. Ethylene is the only gaseous hormone. Sometimes no, the things are not written on the board, but I write it with a pen. So make sure that even if you're tired, you write those things. Don't fret. Don't restrict yourself from writing. Fruit ripening, it is responsible for fruit ripening. I know. Moving ahead, medullary rays. So medullary rays are being asked in GPAT 2018 and 2019. So maybe वापस आ जाए. Star shaped is present in rhubarb. Wavy shaped is present in licorice and cascara. And V shaped is present in Seneca. Can we remember these three categories specifically? Can we remember these three? And YouTube people, don't worry. I'm seeing your reply also. Keep typing. You know, I'm happy that you're watching. है ना, विपुल, गार्गी, तेजस्विनी, गुड. चलो स्टोमाटा. नाउ फॉर स्टोमाटा मेरे व्हाइट बोर्ड पे आ जाओ. कैन यू ऑल सी माय व्हाइट बोर्ड? सो नाउ हियर स्टोमाटा आर ऑफ डिफरेंट टाइप्स and we have parasitic, anomocytic, anisocytic and diacytic, right? So now this table is the only table and इस table के बाहर question नहीं आएगा. There won't be any question outside this table. So parasitic stomata has a parallel shape. Parallel shape. Anemocytes is irregular shape. Anisocytic is unequal shape. Diacytic is cross-celled. So the trick is PIUC. Parallel, irregular, unequal, cross-celled. So you take PUC, right? Pollution under control for cars. We take out PUCs, pollution under control. So PIUC. Parallel, irregular, unequal, cross-cell for parasitic, anomocytic, anisocytic, diacytic, respectively. Then, now parasitic stomata has a different example that you like Senna, digitalis, datura, and vasaka. Okay. So Senna is obtained from Cassia angustifolia, and it is most widely used as senocytes are widely used in your stomach, right? Stomach related problems as cathartics and all. Anomocytic stomata. Digitalis has presence of anomocytic stomata. So digitalis purpurea, digitalis lanata. And isocytic stomata is present in Datura stramonium. And Vasaka. Vasaka mein which ring is present? And Vasaka is a which kind of secondary metabolite? Vasaka is a which kind of secondary metabolites? And which ring is present in Vasaka? Can somebody tell me quickly? Quinazolin, and it is an quinazolin alkaloid. Very good. Datura stramonium is a which kind of alkaloid? Datura stramonium is a which kind of alkaloid? Which kind of alkaloid? Phenol, pyrrole, pyrrolidine, imidazole, indole, tropane, purine. Which alkaloid? Can somebody tell me which alkaloid? Nobody knows. Datura stramonium atropa belladonna. Very good. Tropane alkaloid. And which test is used for tropane alkaloid? Is it Thaliquin test? Is it Vitali-Morin test? Is it Murexide test? Very good. Vitali-Morin. So Vitali-Morin, potassium chlorate is used here as in Vitali-Morin. Do we use potassium chlorate as a reagent in Vitali-Morin? And is purple color obtained? Very good, Tanashri. Very good, very good, very good. Manisha, Gayatri. Good going, everybody. I hope everybody is getting it. Right? Digitalis belongs to cardiac glycoside and Senna belongs to anthraquinone. Anthraquinone has which kind of test? Anthraquinone has which kind of test? This is suppose C glycoside or O glycoside. So which kind of test will be applied over there? Bond tigers and modified bond tigers. Digitalis में which test is applied? Keller, Keller Kiliani, Kedde, Keller Kiliani, legal, Baljet, Raymond, है ना? Keller Kiliani is widely used test for digitoxose sugar, right? And parasitic stomata is also called as rubiaceous stomata. Anomocytic stomata is also called as ranunculaceous stomata. Anisocytic stomata is also called as cruciferous stomata. Diazocytic stomata is also called as caryophilous stomata. Now for this, I have a mnemonic, but you don't have to laugh on this mnemonic, okay? Because I used to get confused at which is ranunculaceous, and this has been a GPAT question, Manipal question, CUET question, IIT BHU question. Everywhere stomata has come when I had appeared. So let me give you one small hint. Ruby, this is in Hindi, okay? So I hope some people can understand. रूबी रानू का क्रूसी लेकर भागी, रूबी रानू का क्रूसी लेकर भागी कार्गो में. So rubiaceous, ranunculaceous, cruciferous, caryophilous. Parallel, irregular, unequal cross cell. Ruby Ranuka. So Ruby Ranu is girl's name. So you can remember because rubiaceous is quite difficult to remember, है ना? So you can remember it that way. Depends. You just have to know this table. It is sufficient. Done. So this was from the table that I wanted to explain. The stomata. Now trichomes. Trichomes are basically outgrowths. Outgrowths. It is written here. Right? So trichomes are of different types. Now, which is important trichome that I have marked on your screen? You only have to do that trichomes. Like lignified trichomes are present in Nux vomica and Strophanthus. Can somebody give me an example of a dog poison? Can somebody give me an example of a dog poison? Let me see how many of you have studied Chandrakant Kokate. Excellent. Brucine, dog poison, right? We have strychnine and brucine as a Nux vomica case phytoconstituent. And what is the synonym for Nux vomica? Crow's fig or foxgloves? Crow figs or foxgloves? What is the synonym for that? Very good. Crow's figs. So foxglove किसका है? Foxglove किसका है? Foxglove is a synonym of. Very good. Digitalis. Shabash. This is the speed. मतलब when I throw a question, immediately answer should come. That is how your preparation should be at that level. Good, good going. Rest all are not important. I would suggest don't do. Now moving ahead, in multicellular unbranched we have unicerate. We have unicerate में bicellular, tricellular, tetracellular. Bicellular में Datura stramonium. Sorry, Datura metal. In tricellular we have Datura stramonium. And in for tetracellular we have Digitalis lanata and Digitalis purpurea. Okay. And 5 cell or pentacellular में we have Atropa belladonna. अच्छा, deadly nightshade family. What is deadly nightshade family? What is deadly nightshade family? Can somebody tell me what is the name of that family? What is the name? हाँ, क्या बात है. Lovely reply. Atropa belladonna. I specifically want the name. Very good, Gayatri. Solanaceae. Solanaceae. Good going. I was supposed to ask you that and you answered. Good. Next up, we can remember T-shaped trichomes. This is specific, yeah? T-shape. So T-shaped trichomes are present in artemisinin and pyrethrum. Artemisinin and pyrethrum. Right? So artemisinin may we have artemether, arteether that are containing which category? They are which pharmacology? What is the pharmacological indication of these drugs? They are used in which disease? Malaria. And what is the ring present? Which ring is present? Which group is present? Is it endoperoxide ring? Is it endoperoxide ring? Trioxane ring? Trioxane ring? Endoperoxide bridge? Endoperoxide bridge and a trioxane ring is present in artemisinin, artemether drug, right? And Artemisia annua. What is a synonym of Artemisia annua? Is it xantonic acids? What is a synonym for artemisinin? Nobody knows. YouTube also nobody is replying. I think so. Everybody is sleeping. Vipul, Gargi, Gayatri, Tejaswini. I hope we are awake, everybody. Vivek, Tanushri, Gayatri, Chintu, Manisha, Samson. I hope you all are awake. I hope you all are awake. है ना? चलो, चलो, चलो. Moving ahead. This all again is not important to be honest, because it is really difficult to remember so many types of trichomes. But one thing that you can remember, glandular trichomes. So we have Piper, Piper nigrum. What is Piper nigrum? Is it black pepper? Is Piper nigrum black pepper, long pepper? What is the difference between a black pepper and a long pepper? Tell me pharmacognosy point of view. Black pepper and long pepper. Let me know how many of you know about this black pepper versus long pepper. Are they both the constituent of certain Ayurvedic preparation? What? Okay. Do we know about the Ayurvedic preparation consisting? One homework for you all. There is one Ayurvedic preparation that consists of long pepper and black pepper together, right? So you should have to find out and okay, right? Anybody who knows it right now? Anybody who knows? Trifala churn सुना है? उसमें क्या होता है? उसमें this is not there, okay? But I'm just giving you all one hint. Trifala churn में what is there? Amla, harda, beda. Trifala churn. Trifala churn. Ayurvedic preparation is important from cognosy. We have amla, harda, beda. What is the synonym for amla? Or a scientific name for amla? Phyllanthus embolica. Phyllanthus embolica. And family Euphorbiaceae. Right? Indian gooseberries, Harda Bahera. So this is a Trifala Churan. Okay. Now there is a Trikatu Churan. Trikatu Churan ke constituent are black pepper and long pepper. Okay. So you have to study about them. Okay. Chal. Very good. Very good. 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 Chal. Moving ahead, we have calcium oxalate crystals. So calcium oxalate crystals are also formed in your kidney, leading to kidney stones. And that is why people are given all diuretics so that urine is flowed and there is pressure. So the stone dissolves. Now we have different kinds of crystals and we have to remember all of them. Remember all of them. There is no escape. So microsphenoid and idioblast are one in the same, but you have to remember it's like it's a type of microsphenoid. So they are also called as sandy crystals, and the most famous example is belladonna and cinchona. Cinchona has a which drug? Cinchona is a which drug category, which is a secondary metabolite, and which test is used for cinchona? Three questions. Firstly, tell me cinchona is a which category of drugs? Cinchona is which two drugs? Have we forgotten? Have we forgotten? YouTube, YouTube, YouTube. I'm watching you all on YouTube as well. Quinine, quinidine, quinine, quinidine, and dextrolevir, anti-malarial, anti-arrhythmic. Quinoline alkaloid, quinoline alkaloid. Which test? Which test? Mayer Wagner Heiger Dragendorf is for common test. That is agreed. There you go. Harlequin test. Good job. Rana. Good job, Rana. Harlequin test. Right? So we have Mayer Wagner Hager as a general test. That is not a test for this. Very good, Tejaswini. Good job. Chalo. So moving ahead, prismatic may we have prisms containing. So Senna, Hyoscyamus niger, you know, Vasaka, Revolvia serpentina, Reserpine, coriander. Coriander may I have taught you all coriander. Tell me coriander has which phytoconstituent? It has two names. Chalo, jaldi jaldi se tell me. Coriander has which phytoconstituent? Coriandrol or D-linalol. Very good, excellent. So remember that as well. है ना? Cluster may we have a cluster type of agent. So where two prisms are joined together. So porophyllum is a very specific example from where etoposide is obtained. Podophyllum peltatum, podophyllum hexandrum. Okay, peltatum is a European category. Hexandrum is an Indian category of drugs. Just like we have Cassia angustifolia, Cassia acutifolia. One is Tenebli senna, one is Alexandrian senna. So Indian one is Podophyllum hexandrum. Please remember this. मैंने हाई करके याद रखा था और हिप Hexandrum, Indian podophyllum. Hip. Hexandrum, Indian podophyllum. And rest will be European. Like Atropa may also. So Belladonna may be also we have Atropa acuminata and Atropa belladonna. Can somebody tell me Atropa belladonna is European or Atropa acuminata is European? Which is Indian and which is European? Which is Indian and which is European? Geraniol is not a it is a constituent, but the main is linalool or coriandol, D-linalool. Okay. Coriander has a very like fennel also. So fennel maybe have fencon, anethol, you know. So that is all asked frequently. Okay, belladonna, good job, good job. Chalo. Now moving ahead, we have one very common question. It has been a hat trick question. GPAT 2019, 2020, 2024, sorry, 2023, Lycopodium spore. 94,000 spores, 25 micrometer, yellow colored, formula 286,000 starch grains. Everything that I've marked is a question. Now I don't know what all question they can make from this, but these all four questions have been asked. Formula, starch grains, lycopodium, and the percent purity. So you should be very much acquainted with this. You should be acquainted with these terms. Then will we? So अब it's time to play कौन बनेगा करोड़पति. Okay, but in our case, everybody is excited. I hope nobody leaves. YouTube pe also, please everybody be excited. Now it's time to play कौन बनेगा rank pati. है ना? It's not करोड़पति, it is rank pati now. So the first question, अरे यार, हाँ. So पहला प्रश्न, let me tell in अमिताभ बच्चन style for you, है ना? पहला पढ़ाओ, पहला प्रश्न. पहला प्रश्न 2000 रैंक के लिए, रैंक अंडर 2000 के लिए आपके स्क्रीन के ऊपर ये रहा. Which of the following stomata is present in uva ursi? Tick tock. You have 60 seconds to answer this question. Para, actino, anomo, and iso. Okay, many people say C, some say D. Para, anomo, actino, and iso. किस पर ताला लगाया जाए? Where should I lock? Lock किया जाए actinocytic? Yes, actinocytic is the right answer. आप जीतते हैं 2000 रैंक. Congratulations. अगला सवाल, दूसरा पड़ाव, सेकंड पड़ाव for 3,20,000 rupees on your screen. Which of the following agent is an example of a partial agonist? You have 2 minutes to answer, but I will not give you all 2 minutes. I will give you all 60 seconds only. Which of the following agent is an example of partial agonist? Okay. Okay. Buspirone. Good. Sumatriptan. Some are telling buspirone. Some are telling sumatriptan. Some are telling physostigmine. So, सही जवाब ताला लगाया जाए. Buspirone पे many people have given answer. Yes, buspirone is the right answer. Buspirone is a partial agonist. Sumatriptan is acting on your 5-HT1D. It is a agonist at 5-HT1D. Buspirone is a partial agonist at 5-HT1 receptors. Physostigmine, levolphenol is a opioid category drug acting on the mu receptor, while physostigmine is an anticholinesterase drug. Obtained from, physostigmine कहाँ से आता है? Physostigmine is obtained from. Do not leave. We still have half an hour left. Lot of new stuff that I'll be teaching today from Pharmacology. So do not leave. Even if you are tired, physostigma venenosum. It is a which containing alkaloid? Which alkaloid is it? Which alkaloid it is? Is it an alkaloid? Is it an alkaloid? Indole alkaloid. Excellent. Indole alkaloid can be determined by one specific test. Any smart student who knows the name of the test, whoever answers this gets a Kit Kat. Gets a Kit Kat in 10 seconds. Okay. A specific test for indole alkaloid. 10, 9, 8, 7, 6, 5, 4, 3, Excellent, Vivek. Van Ox test. I hope you have not copied. Very good. Van Ox test, which has a reagent. There has been a question of on this in BITS HD in your BITS examination. है ना? BITS पिलाने के लिए. So the Van Ox reagent is PDMA, para-dimethyl amino benzaldehyde. PDMA, para-dimethyl amino benzaldehyde. Para-dimethyl amino benzaldehyde. PDMA. Para-dimethyl amino benzaldehyde. Please remember this indole alkaloid. This is how you link your biochemistry with cognosy with ecology. This is all, it's a beauty of pharmacy. You can link your clinical pharmacy as well. You can find out any physostigmine has any clinical effects, any side effects, and a pharmacy practice point of view also you can find. You can keep joining. If I want to include biotechnology, is there any recombinant physostigmine? Till now, it is not there. Can there be any recombinant product? That is how you link your biotechnology as well. अब आखिरी प्रश्न 1 करोड़ रुपए के लिए for 1 crore rupees. Let me know how many of you can answer this question. है ना? So um, so yeah, the next question for the last question, right, for today, and then we'll move on from the other part. Just wait for a moment. My screen is lagging. Yeah. Fluoroglycinol and concentrated HCl is a reagent used to detect the presence of what? Aileron grains, starch grains, calcium oxalate crystals, or lignin. Option A, B, C, or D. Fluoroglycinol, and it's a question for a rank 1, AIR 1. And I hope we all are aiming AIR 100, AIR 10, AIR 1. Nobody beyond that. Okay, lignin. Many people say lignin. So yes, lignin is the right answer. And which is a drug containing lignified trichome? Which is a drug containing a lignified trichome? Can somebody tell me the drug name having a lignified trichome? Strophanthus. Okay. Another drug. Another drug. Senna has. Does Senna has a lignified trichome? Does Senna has a lignified trichome? Yes. Okay. Good. So the right answer is lignin. Okay. So that's it from the question answer slide. Let's move. I hope we are fresh now. I hope I'm fresh again. Right. So since you are fresh, we can continue with one more session. Right. There are a few things that you need to remember, like microscopic evaluation. So in your pharmacognosy, whenever you choose a particular phytochemical or you choose a particular agent, which is a natural product, right? So there are certain things that you have to perform, like TLC, HPTLC. That is a major thing. How will you know that the extract that you have obtained is of that particular chemical only, right? Suppose if I want extract of curcumin, so मैंने turmeric से curcumin मिला, how do I quantify? So your densitometry, RF values, TR retention times, all of these are few parameters that can help you validate, right? Next we have palisade ratio. Besides this, we also have ash value, acid insoluble value, water soluble ash value, है ना? All those things. Foam index. Asha, can somebody tell me foaming index is for which particular one category of phytochemicals show foam? Which is it? Excellent. Saponin. Can you give me example of a saponin containing phytochemical? Can you give me botanical? Very good. Licorice, Glycyrrhizia glabra, and you even have that Dioscorea, which is used in rheumatism, right? Licorice का what is the indication? Any herbal syrup, कोई भी cough syrup उठा के देख लो, it will contain minimum 3 agents: turmeric, licorice, and vasaka. It will contain this 3 agent, no matter whatever it is having extra. Like in synthetic, dextromethorphan and all is common. So now turmeric, vasaka, and licorice is very common in any cough syrup, right? So saponin is used for foaming index, right? Next, we have stomatal number, stomatal index, vein islet number, and vein termination number. So you only need to know the definition. How do we calculate is not of our concern. Neither is it asked in GPAT. You only need to know the definition of these particular terminologies. है ना? I hope we can remember this, right? I hope we are there. Nobody is leaving. Nobody is sleeping, right? Done. Good job. Chalo. Now ahead we have few tests that are used. This table is very very important है ना. इस table से एक question आएगा. There will be one question which will be appearing from this table. So like acetophenone test is specific for lobelin. Okay, it's an alkaloid. Like it is having a piperidine pyridine ring, just like your nicotiana tabacum. Baljet test for digitalis or cardiac glycoside. Barfoed's test for carbohydrates. Biuret test for proteins. Borax bromine water test for aloe. राइट एलो में मैंने आपको पढ़ाया था राइट केप एलो क्यूरेको एलो सोकोट्रिन एलो एलोवेरा वी हैव डिफरेंट कैटेगरीज ऑफ एलो देन वी हैव रेजिन एलो इमोडिन रेजिन Bontrager's test so we have senna which is an anthraquinone glycoside then we have sesame oil so Bowden's test is very very specific for sesame oil है ना तिल का तेल you would have heard about til ka tel so sesame oil के लिए Bowden's test car price I already mentioned in yesterday's lecture Ehrlich's test now this is a new test for indole alkaloid, Van Hoek's test and Ehrlich's test. Ergot is also an ergot. Can somebody tell me the source of ergot? Ergot is obtained from fungus, sclerotium, Claviceps purpurea, rye plant, very good, rye plant from the fungus Claviceps purpurea. Okay, this is all questions that can appear. Then we have Fehis test. Fehis test means there is formation of what? Formation of what? Which is of pink color. Which is of pink color. There is invert sugar. There is formation of something. An aldehyde. Which aldehyde? Anybody who knows? Anybody who knows what is formed in? If not, then it becomes your homework. If not, then it becomes your homework. Fehis test. Invert sugar mein, why is the pink color formed? What is it that leads to formation of pink color? There is one compound form. Okay. It is an aldehyde, a hint for you. Then we have Fraud's test. So Fraud's test is specific for ipecacuanha. So syphilis ipecacuanha is a widely used as emetic agent. है ना कभी किसी को पॉइजनिंग हो जाती है somebody suffering from some acute poisoning so they are made to either given diuretics या तो cathartics या तो emetics उल्टी कराओ या तो फिर यूरिनेशन या तो फिर फीकल कंटेंट से यू एम्प्टी या तो यू गिव चारकोल चारकोल will absorb the impurity will absorb the toxic metabol or toxic substance then we have gold beater skin test for tannins है ना tannins में we have hydrolyzable tannins condensable tannins amla harda behra these are all tannins tea में also there is tannins like theobroma coca coffee arabica coffee tannins have a very good property of antioxidants जैसे flavonoids है ना flavonoids you would have seen the advertisement of that which ad I forgot Vataj and that one tea ka ad is there usme they say flavonoid ki shakti right so that is shakti is due to this phytoconstituent only है ना so please remember this next we have Grignard test for cyanogenetic glycoside can somebody give me an example of a cyanogenetic glycoside can somebody give me an example of a cyanogenetic glycoside कोई मुझे एग्जांपल दे सकता है साइनोजेनेटिक ग्लाइकोसाइड कैन समबडी टेल मी तेजस्विनी विपुल गार्गी अक्षता गायत्री मोहम्मद फातिमा चिंटू विवेक नीना हरिप्रिया nobody knows cyanogenetic glycoside wild cherry bark bitter almond wild cherry bark bitter almond falls under cyanogenetic and in isothiocyanate we have black mustard then we have Halfin's test for cottonseed oil Kedde Keller Killen illegal balloget test for cardiac glycosides. Then we have matchstick test for specifically black catechu. Mandelin's test for Nux vomica. Lieberman, Burkhardt and Salco whiskey. Lieberman, Burkhardt and Salco whiskey test for steroids and triterpenoid steroids. Right? Right. Meconic acid test for opium. Opium. है ना? Opium is obtained from which capsule? Capsule of very good Papaver somnifera. Papaveracea is the family. Papaver somnifera. Opium में there is morphine. Now there are analogs of opium, heroin, codeine, lot of analogs, levorphenol, buprenorphine. Lot of analogs are now appearing for opium because it is widely used for nociception. कभी भी if there is any pain, so they give सीधा opium congener for central analgesia. We have two kinds of pain, peripheral analgesia and central analgesia. Central analgesia कोई surgery के बाद, और if there is extreme pain like diabetic neuropathy or any other pain, then you give a central analgesic. Next up we have spot test. Spot test is for fixed oil. Okay, अब emulsion की बात निकली है. So in emulsion we have oil, water, gum, these three components. Can somebody tell me fixed oil, mineral oil and volatile oil, what is the ratio of oil, water and gum? This was a GPAT question 2017 and 2016. दोनों साल आया है. So can somebody tell me the very good 431, 421? Very good, very good. 121 for oleoresin. Very good. Good, good, good. Fixed oil, mineral oil, volatile oil. Okay, this table is very important. Fixed oil, mineral oil, for. So now they can even deduce and ask you, right? Now 2 to 1 है बराबर for volatile oil. So they will ask you 4:4:2. अब ये जो question था, it was asked in Manipal. Okay, and one of my very close friend वही ये गलत करके आया. How? So they had asked that volatile oil का ratio is what in an emulsion. Okay. So is the ratio 4:4:2, 2:2:1, both A and B, and none of the above? अब this friend of mine had studied from Subramania, so उसमें 2:1 लिखा था, so he marked this. But whenever you study or go for any competitive exam, your question does not end after your question. Your question ends after reading 4 options. तो जब तक आखिरी ऑप्शन ना पढ़ो किसी कंक्लूजन पे मत आना. सो 4:4:2 को अगर आप डिड्यूस करेंगे तो क्या होगा? 2:2:1 ही बनेगा ना. 2 2s are 4, 2 2s are 4, 2 1s are 2, so ये भी 2:1 ही हो गया. So this is how they can manipulate your questions. So you should be smart enough to answer them, है ना? You should be smart enough to answer. Okay, just 15 minutes more. I expect everybody's kind attention, right? कोई भी सोएगा नहीं. Nobody is going to sleep. Okay. चल, moving ahead, moving ahead. Resorcinol test is again for honey. So आपका जो honey है obtained from Apis mellifera, है ना? There are a lot of Apis mellifera, Apis indica, Apis florea, Apis acuta, different Apis, Apidae family. Right? So you have beeswax, है ना, जो आप pharmaceutics में use करते हो, beeswax as a ointment base, है ना? What kind of base it is? Is it oleogenous base, anhydrous base, hydrocarbon base? इस पे भी there has been question. Beeswax, wool fat, याद है ये सब? wool fat, beeswax, lanolin, yellow soft paraffin, white soft paraffin. Very good, very good. Absorption base, right? So this all questions are being asked. Now the next is the shikimic acid pathway. Shikimic acid pathway is very, very important because it has this ring C6C3. Shikimic acid is very specific because it has a intermediate product, that is corysimic acid. It is a branching point. So if they might ask you a question, which is a branching point of shikimic acid. So it is corysimic acid. And you obtain 3 aromatic amino acids, tryptophan, tyrosine, and phenylalanine. They all are aromatic amino acids. Tryptophan is represented by H, है ना? FYW. It is represented by FYW. Phenylalanine, tyrosine, tryptophan. F, Y, and W. This is W. Okay. So which is a test for tryptophan? Aromatic amino acid test. For tyrosine and tryptophan, which are the test? I have taught you all this. मैंने पढ़ाया है ये. Can you all tell me the test? Can you all tell me the test? Can you all tell me the test? Xanthoprotic. Very good. Xanthoprotic test. Besides xanthoprotic, मैंने टाइरोसिन के लिए एक और टेस्ट बताई थी. क्या थी वो? मिलन, फोलिन, कैल्टियो. फॉलिंग CO कैल्टियो मिलेंस टेस्ट, डिडंट वी स्टडी दिस? हमें ये क्यों नहीं आया? सागाकुची टेस्ट इज फॉर, सागाकुची टेस्ट इज वेरी गुड. हॉपकिन फोल इज फॉर ट्रिप्टोफैन, हॉपकिन फोल. सागाकुची टेस्ट इज फॉर सागाकुची, वेरी गुड. अर्जिनिन, अर्जिनिन एज विच ग्रुप? अर्जिनिन में कौन सी रिंग है, कौन सा ग्रुप है? अर्जिनिन में कौन सा ग्रुप है? ओके. ग्वेनिडीन, ओके. ग्वेनिडीन ग्रुप और कौन, विच ड्रग में है? ग्वेनिडीन इज प्रेजेंट इन विच ड्रग? Guanidine is present in which drug? Biguanidine is present in which drug? Let me be more specific so that तुम answer. Very good. Metformin, metformin. Very good. Now this is a synonym that you have to remember. If you don't remember the synonym, it is horrible. Crow's fig physostigma, crow's fig nux vomica, physostigma calabar beans. Revolvia is also called as chota chan. Okay, so छोटा चांद इज रेवोल्फिया. सर्पगंधा इंडियन स्नेक रूट है ना, बिकॉज जो उसका शेप है वो, एनी फार्माकोग्नोसी ड्रग ना काफी यूनिक होते हैं. जैसे पर्पल कलर का मैं बोलूँ तो विनका, इट इज वेरी स्पेसिफिक. अगर मैं बोलूँ स्नेक के जैसा शेप तो इट इज रेवोल्फिया. सो एवरीथिंग हैज समथिंग इम्पोर्टेंट. नेक्स्ट वी हैव विनका में कैथेरंथस सदाबहार. Curare, tubercularian. So tubercularian is obtained from Chondroderum tomentosa, and it was previously used as a arrowroot poison. Belladonna, Atropa belladonna from Solanaceae family. Datura, angel's trumpet. Hyoscyamus, henbane, HH. Stramonium, thorn apple, ST. Duboisia is not important. Cinchona is important. Jesuit's bark or Peruvian bark. Okay. Cinchona is Jesuit cinchona, so you obtain quinine and quinidine. So quinine and quinidine are used as anti-malarial and anti-arrhythmic. Areca nut, betel nut, lobelin, Indian tobacco. It is also called as asthma weed. Asthma weed, very important. Please make sure you either write this table with me या तो आप screenshot ले लो, है ना. I have provided these notes. You will be getting these notes soon. But still, ephedra mahuen. Colchicum is also called as crocus seeds or meadow saffron seeds. Okay, meadow saffron, which is Indian saffron. Indian saffron किसको बोलते हैं? Indian saffron किसको बोलते हैं? Indian saffron किसको, वो which drug is very good? Turmeric is known as Indian saffron. Very good. Turmeric is known as Indian saffron. Good job. Next up we have not important. Kurchi. So kurchi is called as Holoriana antidysentrica. Holoriana मतलब it is used in dysentery, loose motions. कुर्ची बाग का जो extract है people drink for dysentery. Holoriana antidysentrica. Ashwagandha we have Withania or winter cherry or Indian ginseng. Very important. If there is an immune modulator in our body, sorry, if that we are consuming, it is ashwagandha, which is our Indian ginseng immunomodulator. Then we have aconite, which is a monk's hood. Aconite, which is a monk's hood. Vasaka, Malabar nut. Right. From glycosides, we have foxgloves, which is digitalis. Red scale insect, which is cochineal. Musabbar or Gritakumari is aloe. Hypericum, it is used as an antidepressant. हाइपरिसीन जो है, किसी को डिप्रेशन होगा तो हाइपरिसीन की टैबलेट्स आती है ना, इट इज प्रिस्क्राइब्ड. केस्कारा, केस्कारा इज बेसिकली योर किटम बाग या सैक्रेड बाग. तो कुछ लोग ना इसकी पूजा करते हैं. सो इन हिंदूज देयर आर सर्टेन ट्रीज जिसकी पूजा होती है ना. सो दिस इज केस्कारा की लोग पूजा भी करते हैं कभी. ओके. नेक्स्ट अप वी हैव थिवेटिया. थिवेटिया इज लकी नट. थिवेटिया इज लकी नट. Indian squill is jungli pyas. Indian squill is jungli pyas. Okay. Yam is Dioscorea. Genix is Panax. Panax. These all are not important. You can leave it. Visnaga is Khelin. Visnaga is Khelin. Andrographis paniculata is calmate. Andrographis paniculata is calmate. It is a bitter glycoside. बहुत important है. Calmate is very important. Bitter glycoside. Please make sure you are writing with me. Do not leave the meeting. Just 5 minutes more. बट मैं ये पूरा कॉग्निसी के सिनोनिम्स आज खत्म करूंगा. सो ये अगले 5 मिनट तक कोई लीव नहीं करेगा. ओके. टर्पिनॉइड्स में वी हैव peppermint oil, which is mentha. Then we have oil of wintergreen, which is Gaultheria, very important. Then we have fennel, fruit of feniculum. Then we have tulsi, which is holy basil. Then we have saffron, which is crocus, is a tetraterpenoid. Saffron is a tetraterpenoid. Okay. Resins में we have capsicum, which is chilies. Turmeric, Indian saffron, I already mentioned. Devil's dung, एक ऐसी चीज जिसके बिना हर खाना अधूरा है. हींग, right? हींग का तड़का, all would have heard. So asafoetida is devil's dung. Then we have Ipomia batata. So Ipomia batata is sweet potato, shakarkand, है ना? Sweet potato. Then we have benzoin, लोबान. तो कुछ लोग घर में ना लोबान जलाते हैं, है ना? So that लोबान is basically benzoin. It is a resin. Then we have Google. Google is very important. It is scented delirium. Scented delirium. Okay, do not forget about Google. It is extremely important. Next we have colophony. Colophony is amber resin. Colophony is amber resin. Do not leave the meeting. Even I know cognosy is very boring, tiring, but make sure you take screenshot. You see something at least on the screen, or you listen to me, because cognosy is easy. All you need to do is, yeah, if you don't understand to rat lo, mug up things, it's okay. As a teacher, I never advise students to mug up, but some things are made to be mugged up, right? So you can mug up things, no worries. And just last slide left for today. Okay, last slide, but please be present, do not leave the meeting. Kaisalgar, diatomaceous earth. French chalk, which is talc. Fillers earth, which is multani mitti, fillers earth, है ना? Kaolin, China clay. Kaolin is China clay. Light kaolin, heavy kaolin सुना होगा ना आप लोगों ने. Next we have neem. Neem is margosa. तो जो we have soap also, margosa soap, green color. So that is having neem. Pyrethrum, it is also called as insect flower. Next, can somebody tell me which oil is also called as anti-leprotic oil? Can you all give me example of an anti-leprotic oil, guys? Jaldi se. Which oil is cholmugra oil or hydrocarpus oil is a anti-leprotic oil? Linseed oil is flaxseed oil. Theobroma oil is cobutter oil. And the last finally for today is hydrous wool fat or Edips lanolin. Hydrous wool fat or Edips lanolin. Okay. Now, how many people? Multani mitti and licorice are same, sir? No. Multani mitti is basically fillers earth. Licorice is you obtain a stick of licorice. Okay. So licorice is a liquor obtained from mulethi. Mulethi. Okay. Licorice ka synonym is mulethi or jethi mud. It is a stick. So it is not the same. It is having glycyrrhizine. Okay. Please, Kyle, I hope it is clear for you, dear. Yeah, the PDF will be shared soon. I have shared it with the team. They will be sharing it with you all ASAP. Okay, now shall I ask few questions before we end? Hannah, can you all answer a few questions? Okay, I hope you all have attended all my previous 4 or 5 lectures as well on CliMed. If not, then go back, see those 1.5 hour, 1 hour sessions, and because I'll be taking your 9 to 10 lectures. So all of those lectures are interlinked and all of those lectures will cover your 40-50% of syllabus है ना ऊपर से for sure. So see to it that you go through the channel and have a look at them. Okay, so I'll ask few questions before we end for today, right? So I will tell you a few synonyms. You have to tell me the name of the drug. Okay. So the first synonym is Santonica seeds. Santonica seeds. Santonica seeds. Santonica seeds. Artemisinin. Next up, can you all tell me insect flower? Insect flower. A drug that is belonging to the family, any drug of your choice. Leguminosae. A drug belonging to the family Leguminosae. Leguminosae. Okay, black potato. Senna. Senna नहीं पसंद है किसी को. Senna नहीं बोला किसी ने. A drug belonging to the family Rubiaceae. A drug belonging to the family Rubiaceae. Pale potato. A drug belonging to the family Euphorbiaceae. Amla. A drug belonging to the family of Asteraceae. Shock laga, shock laga. Huh? Now let me see how many people answer. Asteraceae. I have mentioned about that drug today. It is an anti, chalo hint deta tha, because star anise, okay. Artemisinin, excellent Nina Razu. Very good, very good. I'm sorry if I pronounced your name wrongly. Withenia somnifera, no. Ashwagandha belongs to which family? Ashwagandha belongs to which family? Ashwagandha belongs to which family? Did I ask about Solanaceae family? Did I ask about any other family? Can you all tell me about Solanaceae family drug besides Withenia somnifera? Besides Withenia somnifera? Any other Solanaceae family drug? Very good. Atropa belladonna, Datura stramonium, Hyoscyamus niger. Can you all tell me a drug belonging to the family Rosaceae? Rosaceae. This is given on Valentine's Day. This drug, this particular agent is given on Valentine's Day. Bitter almond, excellent Nina Razu. I was not expecting that. I was expecting rose as an answer, but very good. Bitter almond, which is Prunus amygdalis. So bitter almond has a very amygdalin. The major constituent is amygdalin. So it is widely used as antidepressant and a lot of use. Amygdalin has lot of use in our body. You know? We have amygdala region also in our brain. So Prunus amygdalis, bitter almond, very good. Now can I ask you a few questions from college before we end today? Now can you quickly tell me about the college agents that we discussed today? Can you give me age? Tell you all a particular ring. You have to tell me which drug is having that ring. Okay, any drug, not that we discussed today. Any drug that is having that ring. Indole ring. Indole ring. Which drugs have indole ring? Vinca, reserpine, ergot. So ergotamine, ergotoxin, ergonovin, ergometrine, vincristine, vinblastin, indole alkaloids. Okay. Physostigmine. Okay. Can you tell me which drugs have quinoline ring? Quinoline ring. Quinines, quinidine, synchronidine. Vivek, did I ask quinazoline? Vivek, did I ask quinazoline? But good try, good try. I always want that you answer all. आप गलत आंसर करोगे and when I point you on that wrong answer, it's not that I'm demeaning you. It's because आपको वो याद रहेगा that हाँ sir had stopped me or somebody had told me about. Can you tell me a drug containing imidazole ring? A drug containing an imidazole ring. Which drug is an imidazole ring? Now bolo, I'll bolo, ab bolo, ab bolo. Hint for all, it is an imidazole alkaloid. It is an imidazole alkaloid. It is an imidazole alkaloid. Nobody? YouTube pay, I think so somebody has answered. No, that is a previous question. Pilocarpus jaborendi, pilocarpine. Can somebody tell me about a drug which is having a pyridine and piperidine ring? A drug having a pyridine and piperidine ring. Not just Cognosy, any. Cology का भी कोई drug चलेगा, synthetic drug. चाहे वो एंटी टीबी कैटेगरी का क्यों ना. Anti TB, nicotinic acid, very good. Nicotinic acid. Any other drug that which I'm expecting? Any other drug that I'm expecting can come? Isoniazid, very good. Pyrazinamide as which ring? Pyrazinamide as which ring? Pyrazinamide as which ring? Very good. Pharmacy, Revengers and Vipul and Tejasvi. Okay, good. Chalo. So I like to play with all of you all. Okay, remember, uh, do not even dare, do not even try to miss my last lecture. My last lecture is always known as a Maha lecture. So in that lecture, I play with you all with MCQs. I throw lot of MCQs from lot of subjects, and I do a quick revision at bullet speed. So I expect you all to attend my last lecture. It will be probably in May 7 or on May 4, depending upon the timings. But make sure you are attached with CliMed WhatsApp group and the YouTube channel. You will be updated over there, and Telegram channel as well. Okay. So yeah, we can end the session for today. Siddesh sir, anybody has any doubts? Samruddhi ma'am, anybody has any doubts? Or we can stop.
Yes, Pam. I think we can wind up. Thank
Okay,
you so much, Pam.
cool. Yeah. Bye everybody. Have a good day. All the best.